Yeah, good morning, good afternoon, everyone, and welcome. So glad you're here with me today. My name is Felicia, and thank you for being part of this important conversation. A little about me. I have bilateral sensorineural hearing loss and started my journey feeling unseen and unsure where to find community. Over time, I found my voice, connected with others, and learned how powerful it is when we share our stories openly. That's why today means so much to me. Representation truly matters. Our panel is titled Black Content Creators with Hearing Loss, Breaking the Silence in Our Community. We'll begin with brief introductions, then dive into conversations and questions, which will be reserved for later. Tim, you can bring up the presentation. And while Tim is doing that, I am honored to introduce our panelists. I'll introduce each person individually. Our first panelist is Erika Jones. After years of hiding her hearing loss, Erika chose to embrace it openly and now uses her platform to raise awareness and reduce stigma. So Tim, let's go to the next screen. I'm just going to read this right quick. Now, hearing loss touches every community, including Black Americans. An estimated 2 million Black Americans have lived with hearing loss, yet research also shows the odds of hearing loss are 40 to 6% lower for Black adults than white adults. Both realities can be true. Lower odds do not mean exemption. Many still face real challenges accessing care, navigating stigma, and finding culturally competent support. What matters most is proactive, informed hearing health. Early screening, protective habits, and timely care can preserve connection and quality of life. For clear guidance on prevention and steps to take, explore evidence-based tips from Hearing Loss Association of America, and we should have that link in our chat. So we'll get that there. Okay, Tim, let's move forward. And so, Erika, your topic is Finding Your Tribe, Building Black Hearing Loss Community Online. Erika, share some core challenges you encountered while building community and what strategies and solutions have worked best for creating connection and support online. The floor is yours, Erika.
Hi, everyone. Thank you so much for having me. I'm excited to be here. I'm going to try to talk slowly because when I get excited, sometimes I talk fast. So I'll try my best. Um, the question, I kind of wanted to just start with giving you a little bit of background about how much I don't hear. Like my left side is it's like slight hearing loss, and my right side is profound hearing loss. And currently, I wear two hearing aids, and that has been a journey for me to get to this point. Um, so I guess I'll start with my community. I think when I first was invited to speak here, the idea of talking about building a Black community and hearing loss world, it kind of threw me. I am biracial. I'm Black and white, and I grew up in an area that was predominantly white, and my mom's white and my dad's Black. So having a white mother, I was raised communicating with her a lot, and my dad too, of course, but it was her mostly that talked to me about um, the intricacies of growing up being biracial, and I was in a mostly pretty affluent white community. I'm from Northern California, and I was raised in Piedmont. It's in Oakland, and it's kind of like a diverse area, but Piedmont is a very isolated area. And so I was one of the only people of color there. There was a few others, and we were pretty much, as far as the black and white mixture, we were all biracial. So it was interesting because when I was growing up, we were considered black and not white, right? So I had some uh, challenges being biracial and being in a mostly white community. I was looked at as being black. So my community with the black people is very small. It's mostly my family, and then I um, also was let's see. So with my hearing issues and my story along the lines of speech and hearing. I was born with a cleft palate, and so when I was born, I had a hole in the roof of my mouth, and I couldn't speak properly. And so I really didn't start speaking until I was about 5 and school aged. And in my area, I had plenty of access. I had speech therapy. Um, Back then, I was from the 70s, so there wasn't as much emphasis on correcting speech problems or identifying them until you were school aged. And so that was kind of a little late for what we would consider today, which is it starts a lot earlier. Anyway, I went through surgery to fix the cleft palate at about 19 months, and then I had a lot of speech therapy, and that was most of my 12 years of speech therapy all through elementary. And then what happened was I had ear aches along the way because, as we all know, the ear, nose, and throat are all connected. And so the speech problems led to hearing issues. And so my hearing loss really began in my middle school age. And I go into my background about being biracial in this type of setting because that was kind of like the main struggle for me. And so when I came to my speech issues, I had a solution. I was having therapy, and learning how to speak was inevitable. For not inevitable, but for me, it was fortunate that I learned how to control air and speak. The hearing issues were not, I wasn't prepared for them. And I I found myself losing hearing at a time in my life when I was already struggling to find community. Um, and so the hearing for me was like on the back burner. I was so isolated racially that the hearing was just another thing that was hard for me to handle. And in high school, I really didn't want to deal with it. And so I was getting by, and and I was offered surgery at 15 to kind of correct the issues. And um, I went through a series of 4 surgeries, 2 on each ear throughout high school, and each one of them, it was for cholesteatoma. At the time, I didn't know that. I wasn't told that. I was told that this was going to fix my infections and hopefully restore my hearing. But unfortunately, my hearing was never restored. It continued to drop, and it really was devastating. Um, and I was offered again. I was in a really um, a, opportunistic environment where I was able to have therapy. I was offered all the things, the surgeries, and I was fortunate enough to have that. And I was also offered hearing aids. And I rejected them. I said, no, I don't want them, because of stigma. And for me, again, when I think about building community, it's just been really hard because of stigma and just isolation. And the acceptance issue for me is challenging. It's been challenging. And so I went on without hearing aids. And I really struggled. I ended up going to college. I ended up going to a predominantly white college. And then the community there for the Black community was there. It was like most predominantly white colleges where there is a percentage of Black people. For mine, it was about 3% Black out of the total. And so that being a university offered at least a small community of people that I could grow with or learn about the things that really I had never learned about being in a white environment. So I was eager to get involved. And the hearing for me at that point, I was just really bumbling along. And I learned at that time, well, in high school, to sit in front of classes and to really pay attention and to really overexert myself as far as educationally, because I knew that I was at a disadvantage. And so I had naturally gravitated toward coping mechanisms that, for the time were working, but they were stacking on me emotionally. And I really didn't even know the impact of trying to live a life without, you know, dealing with life. So fast forward, I started as an adult learning how to get a community, and I did appreciate social media when it first came about because it really allowed me to seek out community without having to be in person. Because again, everything around me just didn't give me access to a lot of hard of hearing communities or anything that was conducive to helping me in that area. And so I really later in life decided that emotionally it was really difficult. And so I started looking at addressing the issues that I had with hearing. And I was an adult when I got hearing aids, like after 30 years of ignoring that part of my life. And so seeking support in this time is a lot easier than I've ever had. Reaching out and just searching, groups online have been extremely helpful. And really just being the change, being an example of someone who's biracial and is the only way that I could really figure out how to present or fix this stigma and work against stigma for disabilities. And everything in my life just kind of represents movement toward finding community. And so finding HLAA was key for me to kind of grow. And that's why I'm really happy to be here. And I'm just happy to begin my journey with growing a Black community and a community within the hard of hearing space. So thank you so much for having me.
Oh,
At this time,
thank you so much. I'm sorry, Wendy, but thank you so much for that, Erica. I was trying to unplug so you guys can hear me. But thank you so much for your experience. There will be some questions for you later, but we're gonna move forward with our next panelist. Next, we're joined by Nemiah Hobbs. Nemiah experienced hearing loss at a young age, and later her hearing came back fully restored. But lessons remained. She is now pursuing graduate studies in speech language pathology and shares her journey to educate and encourage. Nemiah will cover our community, our solutions, overcoming financial barriers to hearing care. Nemiah, can you name a few key financial challenges you've seen or experienced, and what strategies and resources have made the biggest difference in overcoming these barriers? Floor is yours, Nemiah.
Hello, everyone. I'm Nemiah Hobbs. So to start off with my story when it comes to overcoming financial barriers, the first thing was back in Tennessee, the audiology department of Vanderbilt University. They played a key role in like helping my family secure financial support by connecting my parents with a grant from Buffalo Hearing Services, which helped cover the cost of my first two pair of hearing aids. And also, when I moved to Atlanta Public School Districts, where I attended school, they also stepped in and helped cover like repairs and different hearing aids that I received later on in life. So I want to say thanks to my parents for the persistence of researching and continuing to ask questions. Because of them, I was able to get the hearing support that I needed, and which was vital for my success in life. And too often, we have parents, guardians, and even adults that hesitate to seek for help. But resources do exist to overcome financial barriers. The key is to keep asking questions and exploring options. Taking care of your hearing is essential, especially since it impacts how we connect and communicate with others. Out of 100 Black adults 65 and plus with hearing loss, fewer than 10 use hearing aids. And a study done back in 2024 states that 9.3% of Black older adults use hearing aids compared to 31.8% of white adults. And here are some resources that I have listed. The Hear Foundation, they provide free hearing aids for children 18 years of old and under that have low income families. They also require you to have audiograms, and also it's free for kids that are 19 and plus. Also another organization, Georgia Hearing Aid Distribution Program. They also provide hearing aids, but you must live in Georgia for at least a year, and adults must have an income that's below 200%, and also children under 19 have 400% of the federal poverty level, and also babies can't wait. Early interventions for birth to 3 with hearing loss services free also include hearing aids and devices. So those are a few resources that I found. So remember, when you are blessed to have or receive resources that will help cover or lower costs for hearing devices, you should take advantage of it. Don't allow pride to prevent you from getting the services and care you need. Without these resources, then some of us wouldn't be where we are today. Hearing devices and overall hearing care can be a financial burden, but with the proper resources, you can succeed in the deaf or hard of hearing world.
Thank you so much, Nemiah. What a great job. I appreciate what you shared. And we're going to go ahead and come to our final panelist. Finally, we have Vanessa Branch. Vanessa wears a hearing aid and a cochlear implant on her right side. And she shares practical tips and day in the life content to normalize hearing devices and empower others. Today, Vanessa will speak on why we don't seek help, cultural barriers in Black families. Vanessa, could you share several challenges you faced related to these cultural barriers, and what strategies and solutions help you navigate that challenge? Floor is yours, Vanessa.
Thank you. Thank you, Felicia. And good morning, good afternoon to everybody. Just want to thank everybody for taking time out of their mornings, afternoons to come and hear us out as we, you know, as we knowledge you guys about Black community and hearing loss within the Black community. I want to thank also the HLA Los Angeles chapter for hosting us and bringing us so we can have this platform to continue to spread awareness of hearing loss within the Black community. So this topic definitely hits home for me. Let me give you a little background. I have had hearing loss since I was 7 years old. Um, my parents really didn't detect it. It was by my first grade teacher. She noticed that every time she turned her back, she wrote on the chalkboard. I missed completely everything she said. This is back in the late 80s, 1989, 1990s, where hearing loss was still not talked about, especially in the Black community. So I grew up in more of a white affluent neighborhood, but my first grade teacher, even though she's white, she noticed something was off. And long and behold, she told my parents, get me tested, and found out I had hearing loss. So I had my first pair of hearing aids at the age of 7. And I was very observant of how we were um, treated. We weren't treated bad, but it was just the fact that to get the information, to get information about hearing aids. And Nemiah brought up a good point about on her PowerPoint, Milk Ear Foundation. I was part of the Milk Ear Foundation, and they helped me out to get my first pair of hearing aids. And so there is a lot of information out there, but at the same time, within the Black community, it is not talked about. It is seen as weakness, is seen as vulnerability, and and I've seen it play out all through my life, even as an adult. Hearing loss affects millions of Americans, but research and anecdotal evidence suggests that Black families are less likely to seek help for hearing-related issues compared to other groups. The disparity is influenced by a combination of cultural, systemic, and socioeconomic factors. So it's not a one specific thing that affects Black communities why we don't seek help. It's multifaceted, right? Understanding these barriers is crucial for promoting unbiased access to hearing healthcare and improving outcomes for the Black community. Now, we talk about cultural stigma. So those of you who can understand, a lot of you I believe can relate. Within the Black communities, there may be stigma associated with hearing loss and the use of hearing aids, BAHA, and cochlear implants. Hearing impairment can be perceived, like I had mentioned, as weakness or disability. Nobody wants to, have that. And I know a lot of you guys can relate and have somebody when in the Black community, when you talk about it, it is like, nope, I don't want to wear those things on my ears. And it leads to individuals feeling ashamed, embarrassed. They don't want to put that embarrassment. They don't want to put themselves out there and hide their condition and refuse treatment at the same time of their hearing loss, rather than seeking help. Some families may prioritize resilience and self-sufficiency, discouraging discussion by hearing health, and that could be seen as vulnerabilities. And I can definitely attest to that. Like, even though I knew I had hearing loss, it was difficult to try to put hairstyles that didn't cover my hearing aids and growing up. And a lot of times now as an adult, I find a lot of adults said, you know what, I'll manage. I'll figure it out. It's like, I'll deal with it, that self-sufficiency, that self-soothing. And they don't want to reach out for help. They don't want that reputation on them. Um, I'm in the process actually of having this discussion with my own father, who absolutely refuses to get hearing tested. And we have this conversation all the time. My father knows he has hearing loss. And there'll be times he's on the speakerphone and he's screaming on the speakerphone, "I can't hear you." And I'm like, Dad, you don't need to be screaming on the phone. So we have this conversation about over-the-counter hearing aids. And that's another resource that's out there, because we all know hearing aids, Baha, and cochlear implants are expensive. And so over-the-counter hearing aids is another resource to somehow, hopefully, the cost reduction. So I've done some research, and while it is still expensive because of hearing aids itself, it is not as much as prescription hearing aids that fits for your specific type of hearing loss. And I have bisensorineural hearing loss, and I'm deaf in my right ear, and I have severe hearing loss in my left ear. And so those type of hearing aids, the over-the-counter hearing aids, are meant for mild to moderate hearing loss. So I believe because of my dad, he has aging hearing loss, he would qualify for that. But then I'm always having this conversation with my dad to educate him. And that's where we fall into the lack of awareness and lack of education. Awareness about hearing loss and the importance of early intervention is often limited. Many people may not recognize the signs of hearing loss or understand the benefits of treatment. And treating your hearing loss has research indicated that it also helps prevent dementia. It helps prevent Alzheimer's and any type of cognitive disorder. Because when you don't treat your hearing loss, your mind does not get the feedback to listen to all your sounds around you. And so what happens is the person now isolates themselves, and they no longer want to go out into the world. And you start to see a change in your family member, your loved ones. And that's when you want to have a conversation as to what's going on. Are you experiencing some hearing loss? And they may never tell you the truth. They'll be like, "I'm fine. No, don't worry about it." But you have to be persistent and then let them know and that they're in a safe space. Okay? They're in a safe space, and misinformation and lack of information about available resources such as audiologist assistive devices and contributes to delayed and avoided care. And that brings us into how the Black community sees the American healthcare system. So we have all these resources, right? Why is the Black community not, going for these resources? Well, historical injustices and ongoing discrimination in the healthcare system have played a pivotal role in fostering mistrust in the healthcare system. So this goes way back to the 1930s of the healthcare system discriminating against the Black community. It has made the Black community hesitant to seek professional medical help, not just regular hearing healthcare, any type of medical care. And one of the most infamous stories, most of you guys know, but if you haven't, is about the discrimination of the healthcare system, the Tuskegee syphilis experiment. It was a 40-year study, and I say 40 years, by the U.S. Public Health Service that deliberately, and when I started researching this broke my heart, that deliberately withheld treatment from hundreds of Black men with syphilis from 1932 to 1972 to observe the disease's full progression. Now, I don't know about you, but if that was in my family, yeah, I would kind of have some type of mistrust within the U.S. healthcare system. No other race that I have researched has been subjected to this type of egregious medical maltreatment. The study has been considered one of the most unethical chapters and stain in America's medical history that led to catastrophic health outcomes for its participants, their wives, and their children, and for generations to come. The mistrust in American healthcare system within the Black community has now created and perpetuated mistrust for generations to come. So now we're talking about, why the Black community don't seek help. It stems from one of these, events that happen in the American system. And when they continue, if a Black community says, well, my granddad said, they never treated me, so why should I, trust them now? I would understand why they wouldn't seek out help. And so not only we have trust in the mistrust in the healthcare system, we have socioeconomic factors. The cost of major consideration, hearing aids, Baha, and cochlear implants. So I mentioned this earlier, it is very expensive for audiology services. Insurance covering them, my Lord. I've been through so many insurances that literally had no answers for me. When I called the insurances and I said, okay, do you cover hearing aids? And they had to put me on hold, and then I would get cut off. And then I had to call them back and then ask a different person. And then it's getting frustrating. You see the pattern. There is no resources about hearing aids. And then finally, when I get somebody, it is, well, you only covered for one hearing aid every 2 years. Well, I'm hearing loss in both ears. How does that help me? So now I'm forced to seek out other resources because the insurance is not going to help me. And so with that, insurance coverage for these services is often limited, no recourse. Families with lower income in poverty have decreased access to healthcare, and may not prioritize hearing health. Like I said, they may think, I could deal with it. I'll be okay. How many times have you heard somebody be like, it's not that bad? It's not that bad. If they perceive hearing loss as less urgent, they will prioritize other essential needs over hearing loss. But long and behold, I had mentioned earlier, hearing loss is connected to cognitive decline. So one affects the other. And so this type of information we need to really make people aware. And once they get treated for their hearing loss, I have seen turnaround, oh my God, almost 90%. And a lot of times I say, I wish I would have known about this earlier. And this comes down to now representation and advocacy. Black communities, people in the Black community don't see others like them. It's only now in my adult years that I actually seeing adult or Black audiologists, Black female audiologists. And I'm like, wait, where y'all? And so when we see others, when we see medical professionals that look like us, we are more inclined to go get it treated. We are more inclined to say, you know what? Okay, let me see what she's all about, because they're more culturally receptive, and they can understand our culture a little bit better. A lack of representation among hearing health care professionals can make Black families feel intimidated, uncomfortable, or misunderstood when seeking help. And that was like one of the things I was talking about as a little girl when I had to seek out hearing aids. I did not grow up with anyone that looked like me. And that was the first thing. When I got my hearing aids, I was looking for other people to say, okay, is there anybody else that looked like me? And I didn't. I can definitely attest to the fact that it was intimidating, out of my family's field of scope, and uncomfortable on how to treat my hearing loss. Black families are less likely to seek help if they do not see a medical professional that look like them, especially among hearing healthcare. Few outreach programs specifically target Black communities to raise awareness, provide culturally relevant resources without relevant resources. Without strong advocacy or community engagement, these gaps are going to just continue to get bigger and bigger. And definitely, once I started seeing Black audiologists in social media, and thank God for social media, I'm going to go into the solutions next. Social media has been such a pivotal point in my journey, in my solution to bring awareness in the Black community. Breaking down stigma, increasing awareness, and improving access to some education and solution starts to help Black families seek support for hearing loss by promoting culturally relevant education, policy change, because look, the insurances are not covering our hearing aids, and the short story that I also just realized, when I got my cochlear implant upgraded, the first time insurance covered both my cochlear implant and my hearing aid. Now the upgrade, the insurance only covered my cochlear implant. I had to pay my hearing aid out of pocket. So now there is this policy change like no one was told me about. And luckily I had flexible spending account, FSA, to pay for it. But that's another thing about education that we need to be more aware of. And representation in hearing healthcare, we can empower families to prioritize their hearing health. It was not until I was burnt out from my last job, because I'm a social worker and all the time I'm on the phone, but I realized that I was experiencing listening fatigue, concentration fatigue, and I said, I must not be the only one going through this. I know other people are. And that's when I started my journey in deep diving more about hearing loss. And then I'm seeing a lot of theme that people were feeling alone. And I said, no. I said, I'm going to do something about this. And so that's how the National Hard of Hearing Forum was founded by me. So I can create a platform to bring everybody, especially people of color, especially our Black community, to let us know that we are not alone. We're not alone in this. I realized there was a lack of communication about hearing loss and hearing healthcare within the Black community. I even went to an HLA New England conference back in March in Boston, Massachusetts. I had a great time, engaging with everybody who had hearing loss. However, it did not escape me that it was only me and another Black woman at the conference. And that really struck a chord with me. I didn't feel any type of way. It was just the dynamic. I was in my head wondering how many of us, people of color, Black community, would have known about this conference, could come to this conference and get all that beautiful, amazing resource information that was presented at that conference. And that is why I created the National Hard of Hearing Forum. So these conversations that are not being had can be had. And in this space, resources can be shared and otherwise would have not been known. I encourage you guys to visit my website. That's here on the slide, National Hard of Hearing Forum. And I also have an Instagram at National Hard of Hearing Forum. And I have a subset channel, which is called The Listening Lounge. And it was doing so well. And that's how I met our host, Felicia Adams. We talk about anything and everything hearing loss related, especially as a Black person, especially as a Black woman, because our journey is different. There are things that we've experienced, in the Black community that is not experienced in other groups. So as I conclude this, the reason why Black families may not seek help with hearing loss are complex and multifaceted, involving cultural perceptions, unlimited awareness, healthcare access challenges, socioeconomic constraints, and representation issues. Addressing these barriers requires targeted education, like I mentioned, improved access to affordable healthcare, and culturally competent providers like Black audiologists and community-based advocacy to ensure that all Black families benefit from the resources and the support that they need that are readily available. Like all these resources are there, and we just need to let the Black community be aware of it. And thank you guys for having me.
Oh my goodness. Thank you so much, Vanessa, Erika, and Nemiah. I am hearing things around stigma, building community, and unlocking access. Now, we can take a couple of questions, Q&A, if anyone is interested in asking us questions. And thank you to our panelists and everyone who joined. Any questions, anyone?
I have two questions.
Go ahead.
First one might be for Nemiah. It sounds to me like you grew up in Atlanta, and when your parents were looking for resources, they found some at Vanderbilt, which I think is in a different state. And then they connected you with something called Buffalo Hearing Group, which I'm guessing might be in yet a third state. I'm always thinking about resources being local. Do you know of like regional or national resources for parents looking for help with audiology or hardware purchases?
For me, not at the moment, but I can do some research, do a follow-up with you about that because I'm still learning myself about different resources. So I can definitely do some more research and finding some more resources for you.
Oh, I don't want to put any burden on you. I was just kind of curious. It's an
Oh, you're
interesting
fine.
area,
You're
though.
fine. I'm still learning myself.
Yeah, thank you. And I also had a question. Maybe this is for Valencia and Wendy. HLAA's organization has chapters that have been historically built around geography, right? We have an LA chapter, New England chapter. There is an increasing interest in having more virtual groups. And the one that is probably the best known right now is the Veterans Group. It's a virtual national chapter. I don't think there's one for African Americans. You can correct me if I'm wrong on that. Would you guys have any interest in either working with, I'm sorry, Vanessa, I'm blanking on the name of the organization you just mentioned, to bring that into like an HLA context or in setting up a virtual chapter for African Americans within HLAA?
I'm interested in, raising awareness, and I have no problem doing that. But I don't know, I'm not aware of the name. But as a matter of fact, I went to a convention in Wisconsin, and there was a veteran that was speaking on behalf of those with hearing loss. I could do my own research, with a colleague that's in Wisconsin and asked her about that gentleman. He was a veteran. He had on his uniform, and he talked about hearing loss with veterans. So yeah, I can check that out.
And as far as the LA chapter goes as a whole, we are often open to, collaboration and any sort of thing like that. I do know that veterans are a huge group that require, audiology attention. And I know quite a few of them get their services through the VA. And so that would be one way, of connecting. I don't know if there's specific groups like within the VA that are already dealing with people with hearing loss, but we've always been open to working with and connecting with veterans. So if anyone has any specific contact, especially since there is the VA in West Los Angeles, we would be happy to meet with, work with, collaborate with them in some way.
Okay. I'll reach out to you offline.
Okay.
Oh, she got it. Okay.
Oh, I'm sorry, I didn't, I didn't read that in the captions. Okay, anyway, I'm here. I'm Sarah Ozer. I have bilateral cochlear implants implanted right side 2020, left side 2022 by UC San Francisco. I'm president of the HLAA North Bay chapter. We're north of San Francisco in Marin and Sonoma counties. So I do presentations on living with hearing loss, you know, or coping with hearing loss, whatever you want to call it. I go to outreach events like Marin Senior Fair, Santa Rosa Senior Expo. I have a table with information. So I'm not sure how to reach out in a culturally appropriate way to the Black community. And I had heard before that Black churches may be a way of doing that. I could have my presentations there. What I want you to know, though, when it gets to the part of paying for hearing aids, that's real sticky. That's hard for everybody, any color in this country, right? It's a big divide between people, any color, that have money to purchase anything. So yes, I can present about hearing loss and what it feels like and how to communicate better, types of hearing aids, cochlear implants, how to get them, over-the-counter hearing aids. I can do all that, but I'm not sure how I could reach out to the Black community, and that's why I'm asking. How about Black churches?
That's a yes, that's a great idea to reach out to Black, but they have to be open to receive that information. It's a lot of pushback from individuals or organizations whenever you're talking about hearing loss. It just it's they're not interested. They struggle with understanding hearing loss, and a lot of them will agree to participate, but then they don't follow through. And so this is the reason why we did this presentation, because we want to put it out there that there are resources and that there are people that can help you with resources and tips and strategies to live a more engaging life. And you're right, the financial part applies to everyone. However, in our community, it just hits different. It's not to take away from what you're saying. It's just because of our culture and how we receive our medical diagnosis or not. A lot of them would rather not know than to know. And we want to stop that. We want to change how people receive or deal with living and being diagnosed with hearing loss.
You know,
I hope
Sarah,
that.
yeah. Sarah, I want to say that's a great idea too. Just because you're entering in their space, you're going into their comfortability, what they know. And so now they have no choice really to listen to what you want to present. And it will allow them to think about it. They may not necessarily receive it right then and there, but they go home and marinate with it. And then they say, you know what, that lady came and she was talking about, resources for hearing loss. I want to know more. So you plant the seed. and then it will continue to breed. So definitely that's a great idea.
Thank you.
I just want to say I agree with that as well, Sarah. If you are able to reach out to Black churches and arrange for presentations and take materials that they can take home with them, as was already mentioned, something that they can peruse later and something to think about. I think that's all you can do. That's all we've always tried to do in terms of HLA. We are a support group first and foremost, and sometimes just having the emotional support and a little bit of education is enough for someone to feel comfortable, confident enough to say, maybe I will take the next step. But I just think that that outreach is just so important. And if you can arrange to speak at a few churches during the week, they usually have senior activities and things. Maybe you could be on the, special guest on a Tuesday or Thursday or something and just come and talk to people, share some information. I think that's wonderful. And that's what we all need to be doing is, more outreach to reach Black people as well as everyone else who's in need. But outreach is really important.
Okay. Thank you.
Anybody
All
else?
right, so we're gonna go to our next question. Shannon, if you're ready, we'll take your question, dear.
Hi,
Oh, you said-
ladies. I don't have a question. I have more of a statement. I met all of these wonderful women via Instagram or social media. So I feel like we're in the time nowadays where we can share our stories and talk about things. And if you can do that, I think it helps because then you open yourself up to so many resources and so many wonderful people that are a part of our hearing loss community. And I'm so happy to have met Vanessa, Miss Alicia, Erika, and I think this is a great platform. So thank you all for having us on here.
Thank you so much, Shannon. All right, so is there any more questions or comments or
Yeah, Alicia
statements?
Fernandez, she's waving out it. There you go, darling. I saw you. I was like, yeah, no.
Hi, Alicia.
Alicia, I just wanted a couple comments. I wanted to say to the lady, I lost her. Wait, I'm bad with names. Anyway, the lady that talked about her dad. My dad, I'm Latina. I'm an immigrant, and my family. My grandfather, I'm completely deaf now, had normal hearing, genetic hearing loss, went deaf by 50. My dad had age-related hearing loss, but he's this old-fashioned Latino man, and he's gone now, but he was very embarrassed or whatever. And many years ago, I was one of the founders of HLALA, and so for 20 years, he heard me going on and on and on, being an activist. And so what does he do? He comes to visit me from Argentina, and, I thought he wore a hearing aid. I wasn't paying attention. And then one of his friends called and said, could you make sure your dad gets his hearing aid fixed because it's not working right? And I'm like, I didn't even know he wore one. I didn't know what the heck was going on. And he was like, oh, it's no big deal. I don't need to do it, whatever. And I think a lot of hesitation from him was because of the language barrier. I think he kept thinking, I'm going to try to have a test, and I don't even know half the questions. And so I actually reached out to hearing loss places and found somebody who could do the test in Spanish. And I think that was a big relief. Number one, he didn't want to face it just flat out. But number two, he knew he'd be comfortable. And I'm not comparing with the Black cultural issues. Latino issues are very different, but it's this kind of traditional fear of seeming weak, but also there is the barrier for people with foreign languages that may speak English, but it's a whole different thing when you're doing a test. So there are these barriers for different groups for different reasons, and they're huge. And one last thought, and I'll shut up. In HLA, we always had trouble reaching out to young people of every age. Obviously, I would love to be like totally diverse, but just younger people, because as we've all mentioned, when you're young, there's the stigma that you're an old person if you're hearing aids, and like the kids don't want to do it. And I honestly don't have a clue how to reach out to people, say, under 35, to get the help they need. I don't know if it's possible to go to colleges or high schools and actually engage, the African American clubs, Latino clubs, just general student clubs, and do presentations or something. I don't have a clue to how to approach that. But if anybody has good ideas, we'd love to hear them. Thank you. Sorry, I have talked too long.
Thank you, Alicia. And those are some great ideas about reaching out to the younger generation. And well, they cut from a different cloth, and I still think we should give it a try. I mean, the outreach efforts is important, as Wendy said, and we need to make it engaging. Like, it has to be something that spikes their interest, like they want to know more, right? Because that generation is smart, yet everything has to be so fast, and real tech, everything is techy. And so we want to come there prepared for them to feel included and not think, oh, these old fuddy duddies, we don't want to listen to them. We want to be upgraded to their standard, how they function, what they do, what interests them. And that is a great idea. I am always game for brainstorming with anyone.
Thank you.
Thank you.
If I can I would just want to make one more mention. In my line of work, I make presentations regarding emotional intelligence, and I use my hearing loss and my journey in corporate environments and in areas where there's like working people to share with them, by being an example, and I just basically use my story to kind of, again, be the representation amongst people, all people, because there's so many of us out there who are struggling, who aren't ready to deal with this issue, like myself. And I just really wasn't aware that there was an emotional dissonance in my own life, and in understanding that there are solutions to this issue. And there's aid out there and there's support. And I just really wasn't living up to my own needs emotionally. And so once I started doing that, and it's hard to say how that came about. My kids really played a big part in like bringing awareness to me about what I was missing, and just this self-awareness of how I was in environments and why things were a struggle really allowed me to get onto the other side. And so I started incorporating that into my work, just to be that person who reaches younger people who are hard of hearing. And it's not only an older people thing, and it's not only a white thing. We are biracial and Black, and we come in all colors. So I just really wanted to say that if we just speak about our existence more and share more, amongst even our hearing friends, it reaches people. And you just have to be the change, because it's really hard to know because it's an affliction that affects all people of everyone. it's important everywhere, right? So we need to bring it to the awareness of everyone, not just in small spaces. But I think the focus is needed, and I also think just the generality and seeing us more out there is important.
Thank you for that statement, Erika. And we're going to go next to Brenda.
So, first to the panelists, thank you all so much. It's wonderful to hear each story and kind of start processing that and feel through my own story and just acknowledging your story. And we were talking about reaching younger folks and, how to make it techy and, to their standards. It might be worth it to reach out to some of the technology clubs or the clubs that kind of, are at the forefront of promoting technology. They might have ideas about how to put it out there. They might not be directly impacted, but, it could be a project for them to, to work toward. The other thing I was thinking about, like the Apple earbuds, I don't remember like which series. I know one of their earbud products has been can be classified as hearing aids, and so I'm wondering like how many young folks are using like the Apple earbuds as their hearing aid, right? And so are they starting to look at technologies that are not directly considered hearing aids? And so I don't know, just in reaching them, like Apple is trying to not only reach them but reach others. And so,
Thank you, Brenda. Those are some great ideas. I mean, this is the reason we host this presentation, thinking outside of the box. And again, the efforts to reach out and let others know that this is a space, this is where we are, and can we collab? And I appreciate you sharing your thoughts. Thank you so much. We have next up Christopher. The floor is yours, Christopher.
Hello, everybody. Can you hear me okay?
Yes.
Okay, wonderful. Yeah, back to what Brendo was saying. I have actually used Apple AirPods, and I'm kind of a technology guy. Like I know a lot about technology, so and they work pretty well. Yeah, it's a great like little starter kit if you ever have mild to moderate hearing loss. They're also great for like isolation. So if you want to just hear a phone call without all this, that they do have like a noise isolation, so they work great. But if you have like moderate to severe hearing loss, I probably wouldn't recommend it. But the great thing is a lot of hearing aid manufacturers, they're starting to go with the over the counter things that are, much cheaper for the average person. So I think that's great. And another thing I just wanted to add is thank you for, Valicia, for, for getting this started. I also have a social media. So a little bit about me. I actually developed. I have actually had hearing loss, mild to moderate hearing loss, but people always think I'm faking it. And I like Erica, just like her story. I kind of got my hearing aids at a very, very late age, like at 34. So for a really long time, I was like literally in the dark ages. But I'm here now, and one thing I wanted to share is that I love music so much, and it just kind of affected me for so long. So now that like I kind of had a late start in life, but now I'm starting to make music, produce music, and hopefully it's an inspiration to people out here who really, really love music. And so yeah, so I'm out there performing and doing shows and doing open mics. So if you could just follow me on my social media, I'll post it on the chat here. But yeah, the help would be so great. I haven't really talked about my hearing loss because Of course, being a musician is a huge stigma. Like, I don't want anybody to know, like, I can't hear certain frequencies. And plus, being a male, of course, you don't, you have your pride. Um, and also, I don't really like talking about myself. So this is kind of a, you know, unusual but great thing for me. So, thank you so much for, for all your support. And yeah, I know Wendy's heard some of my stuff on Facebook, and she cheers me on, and thank you for that. And also Alicia, I know Alicia has given me a shout out on my Facebook. So yeah, thank you for that too. I'm gonna post my social media on Instagram, and I'm gonna start a YouTube hopefully soon, and maybe talk about my hearing loss journey. But again, it's really tough for me because it's like, I don't know why I'm just so kind of embarrassed and have so much pride, especially with music, because music is so essential. With, you have to be able to hear certain frequencies, and if somebody, like, let's say you're in a choir and somebody blurts out, "Hey, play this in G," right? I can't hear that well because I need, I have these third party ears, and then I have to hear what they're saying, and a lot of times I'll miss what they're saying. So, but now I'm just getting to the point where, like, you know what? I don't care. I'm just gonna make my music. I'm just gonna sing and, you know, sing to my own beat. All right. Thank you everybody for allowing me to share my message.
Christopher, for being so transparent, and that's perfectly okay because we've all walked that road, especially if you were struggling. And I struggled. I was late like you. I was not near my 50s before I even thought about it, and I was miserable. However, once I started wearing wearing hearing aids, and in my case, it was the representation that bridged me to advocacy, and here I am today. So I understand, and yes, we want to follow you and chop it up with you and make you feel better. I know that heavy feeling you're talking about, and that's perfectly normal. And we can ease out of it. It just takes a little work, right? That's my motto. So thank you so much for that.
Thank you.
And we're gonna move forward on with Lisa. Hi, Lisa.
Hi. It's really nice to see some familiar faces. I just wanted to thank, first of all, Wendy and Felicia, all the speakers for having this session. I think it's so important, especially in these days, to hear different perspectives. So I really enjoyed the stories told today. I had a question or maybe a comment. I don't know. We're talking about representation and advocacy and outreach. And I think one thing that I've encountered as an Asian American is it's like I either have to put on my Asian American hat or I have to put on my hearing loss disability hat. And sometimes I don't want to put on any hat, but I think that's been sort of a challenge. It's like I need to speak about Asian American issues, and then I need to speak about disability issues, but that intersectionality has not really been there. I think it's becoming more like of a common word and people know more about it, but I'm just curious if that's something that any of you have faced, and, you know, I'm curious about your thoughts on that.
Yeah, if I can respond real quick, I totally relate. Like being biracial, I call it the messy middle. And so I can just parallel it with being hard of hearing because I'm not all the way deaf and I'm not all the way hearing. So there's definitely intersectionality, and that's what I talk about a lot in my advocacy for hearing loss. Is just that these issues just are compounded, and we all live in that space, and we have different sides of ourselves. And it's really a choosy game. Like it's like sometimes it works in this environment, sometimes this works better here. bringing it all together has been my, like, the passion that I have is like trying to let people know that we all have these intersectionalities, and it's just of, you know, just advocating it by just speaking it and bringing it to the attention of people. And no matter what color you are, no matter, you know, what you're dealing with, we all have that, you know, and that's where that's where the commonality lies, I think. So
It's funny you said that, Lisa, because I've never thought of it like that, because I think in my case I hid so long that once I embraced that this was my reality, I just wanted to shout it to the mountains. And so I don't see myself as the disabled person. I see myself as a person that has uniquely decided to live her life in my reality. And my reality is my hearing loss. And my hearing loss is every day. You wake up every day and you have hearing loss. But I don't wake up every day thinking, oh man, I got hearing loss. I just wake up every day, grab my favorite best friends, put them in, and I'm good. And if I'm walking out and I realize, hey, something ain't right, I run upstairs and get my best friend. And so that's how I've been operating. I think that's what you mean, but I never looked at it the way you just put it. But that's going to have me to thinking, where are you, Felicia? Like, what are you doing here? But thank you for that.
I also wanted to put in, I see exactly what you mean, because I've been stopped in the streets by, you know, people of color or Black communities, and they're like, I've never seen anybody, you know, like you who wears a cochlear implant. How do you? The first thing that they ask me is, how do you deal with your disability? And so, and I'm trying to marry that as a Black woman into that disability portion. And like, you know, Felicia, I really didn't think about it like a disability, but I know I do, because, you know, I'm deaf in this ear, and I use resources, um, like an FM system, assisted listening devices. And I've actually been involved in VRC in New York City. It's like an agency that helps people with disabilities. And so um, when I let them know about all these resources, it's like, oh, wow, how come I never know about this? And so it depends on the person that's asking you and what environment you're in. But definitely I can attest to being put on that spot, as a Black person trying to marry your disability together.
Um, I just want to take a moment at this time, because we have about 10 minutes before we close this meeting. And I know a lot of people are dropping things in chats, and we're asking folks to, you know, check out this website and follow that one. But I would be remiss if I didn't ask everyone to join our Facebook group, Hearing Loss Association of America, the Los Angeles chapter. Please join our group. It is private, so we have a public page, we have a private page. The private page requires approval, but we're happy to approve you just like that. And then we ask you to share on our Facebook, and let's, you know, continue to be engaged, share information, ask questions, but please be a part of our group as well, because we are still growing and extending invitations to everyone and offering our support as much as possible. So, and then for our members that have been around for a long time, don't forget about us. Come back, join the Facebook group again, and happy to see some of our older members, people who've been around a long time. So don't forget about us.
My name is Pavia Hubbard. I'm calling from Milwaukee. I've just listened to all y'all conversation. Just to let you know that being supporting with the hearing loss. Also, some of the, I'm not gonna say some, 1,000 people in America is not admitting that they have hearing loss because they don't want to wear hearing aid or cochlear implant, excuse me, trying to be normal. But it's very important that people need medical help and assistance, excuse me, about wearing hearing aid or cochlear implant so they can be hear better world out there. But you know, some people just don't want to do that. They just want to play lay back and cool to be normal. But when someone yelling at them conversation, what you say, I know that, you know that the person really need help, but they don't want to confirm that. But it's the best to, you know, to go out in the world to the church, school, or meetings about it and kind of get the word out so they can get a special attention about that. Of course, the insurance only stopped at age 18 because you got to pay something out of your pocket, you know, over the 18 on up, because there is no financial help for hearing aid to pay for. That's all I'm saying.
I appreciate your sharing your thoughts. Thank you. And it's great to see you too.
Just a real quick question, because I know we're closing. Do you guys have either business cards for the HLA information or a flyer? Because what happens to me is I literally will be at the cash register and somebody sees my cochlear implants and says, oh, this just happened at Trader Joe's. My aunt just got cochlear implant. They didn't tell her anything. It's not working right. She's freaking out. And I'm like, oh no, she needs rehab. She needs to work on it. It takes a long time, but I'm at the cash register. I can't keep talking. So I quickly wrote down HLA. But if there's cards or anything, you don't need to print them. If you put them online, Tim, I will print them out. We have a printer, and that way I can just hand them the information. Thank you.
So we do have business cards. We do have business cards. Currently, our steering committee has them, but any member who is in need of cards or flyers, we do have materials. Just let us know. Okay. We actually have materials.
Yeah, I have my own business cards as well. So, you know, I can give it to Tim and then you can print them out.
Sarah, you got a question or a statement, Sarah?
Unmute. Unmute. Oh, okay. What is it this time? Oh my gosh.
Sometimes it's when you hit it and it disappears, and you hit it and it disappears.
This has never happened before where it's so hard to unmute.
No, it's not working.
Okay. We can hear
There
you
you
now.
go. I got it. Okay, thank you so much for this conversation. I want to encourage you to create an.
Oh no, I went back.
You just muted yourself. Unmute again.
And
can't hear you.
Now, good?
Yes.
Okay. Thank you for this conversation. I want to encourage you to continue with an HLAA conversation about being more inclusive of the Black community. We can put it on Groups.io and make it available across all the chapters in the United States, because otherwise a white person like myself doesn't have the chance to talk to Black people. I mean, it's really difficult. Thank you.
Thank you so much for that statement, Still. We keep that in mind. Thank you.
Yeah. Thank you, Sarah. Thank you, everyone. We do have time for one more comment or question. We're trying to let this go to the last minute. So if anyone has anything else they would like to add, this is the time.
Somebody's raising their hand.
Who's that?
Ramona. Ramona, unmute yourself.
No, I'm fine. I was just congratulating. I was actually like doing clapping, not asking much.
Okay.
Thank you, Ramona. Good seeing you.
So anybody else? Anybody else? Well, okay. I just again want to thank our panel for that wonderful presentation, Erika Jones, Nemiah Hobbs, and Vanessa Branch. That was fantastic. I want to thank our Vice President, Felicia Adams, for bringing these ladies together and setting this panel up and sharing it with our chapter. This was a wonderful meeting, and I want to thank everyone for their attendance, their participation, their continued support of the Los Angeles chapter. We are just very, very happy this morning, or I should say this afternoon. Oh no, it's still morning in Los Angeles. Okay, it's this morning, this afternoon, whatever it is, we're very happy. And again, thank you all for coming out. I would like to also thank our captionist, Lisa Johnston, who does a fantastic job, and we kept her over. So thank you so much, Lisa. And I know it's time to give you a break. I would like to also thank Tim, who is our treasurer and our tech person, and he's helps to put this meeting together. It wouldn't be possible without him. So thank you to Tim Browning. And this has just been a great meeting. So thank you, everyone, and have a wonderful weekend.